This segment of DelmarvaLife is sponsored by TidalHealth.
You might remember last week when we spent time with Dr. William Durand from TidalHealth hearing about how he had reached a special milestone, 2,000 successful Mako robotic surgeries. But robotic surgery plays a role in other medical procedures beside hip and knee replacements.
That's right. This complex technology is also useful in surgeries that involve more delicate organs as well, like the lungs and the heart. Rest assured that TidalHealth is constantly at the forefront of the most effective and cutting-edge techniques. One person who knows that well is Dr. Kurt Wehberg, the Executive Director of the Center of Robotic Surgery with TidalHealth. Welcome.
Thank you for having me again. Thank you.
So tell us about this. How is robotic technology being used in cardiothoracic surgery at TidalHealth?
Robotic surgery is being used now pretty much for every specialty field. Orthopedic surgery has a huge application. All of what I call corporeal surgery, from chest surgery, abdominal surgery, pelvic surgery, pretty much all surgeons now are using the robot. So in fact, about 25% of all operations are done with the robot in our hospital systems here in TidalHealth.
Wow.
So what heart and lung procedures are you doing with the robot?
So in cardiothoracic surgery, we pretty much do everything now. Back in the day when I started surgery, we weren't doing anything robotically. 98 to 100% of what I do now is all robotic. So pretty much every procedure I do, anything on the lung, anything on the diaphragm, most of the heart operations I do now are with a robot, using a robot, but not all surgeries are being done exclusively with the robot in the chest.
So just so folks know, it's not like a walking robot like we remember from Lost in Space, but how is it beneficial as compared to traditional surgery?
Great question. So I categorize it in terms of autonomy. So in aviation industry and the automobile industry, there's levels of autonomy, meaning the car can pretty much drive itself now. We have the Waymo cars that can have what's called level 4 autonomy. In robotic surgery, the surgeon is still making the independent decision. So we're at level 1 autonomy, meaning there's some AI assistance, but whenever there's a process within the surgery that the decision has to be made, the surgeon still makes that decision, and the surgeon controls all the operation.
So the robots aren't taking over for the surgeons.
Independent decision making by robots are not there in the operating room yet, but they're coming. We now have a robot at TidalHealth Atlantic and Nanticoke where we have telesurgery presence. So in other words, I did a surgery the other day using the robot, but the surgeons from the different hospitals are dialing in and can watch me do it, and I can train them as well.
Wow.
So that's the first foundational step of actually telepresence. So we're gonna have a day pretty soon, within 5 to 10 years, where I can be at TidalHealth Nanticoke performing an operation at these other hospitals. So that's coming, but we're not there yet.
Not there yet.
So what does this kind of access to this kind of technology mean for the folks in our community?
So that's probably the single best application for robotics I love. And we used to have something called medical tourism, where a patient, let's focus on the patient would need advanced surgery and would have to go somewhere else, across a bridge somewhere, to get that surgery. The greatest benefit of the robot here on the Delmarva Peninsula is now we give access to all of our patients. So pretty much any operation now can be done with state-of-the-art technology using robots here on the shore. We have 4 robotic programs now within TidalHealth. We're soon to be having another 5th program in Millsboro. We're building a hospital in Millsboro where there's going to be a robotic presence as well. Pretty much all the hospitals now have the latest and greatest state-of-the-art technology with the robots in our own hospitals. In fact, we have 15 of those, and I direct all the programs of the hospitals.
It's wonderful. We can just stay on the peninsula and get the quality health care.
So that improves access. The other thing I like about the robotics is that it improves the surgeon's performance. So I would say, in my career, I get to know all the surgeons, and most surgeons are good. 90% of surgeons are good. 5% are outstanding. 1% are goats. Robots allow for all surgeons to become goats, the greatest of all time. So that's what I love about robotics, is that it improves access for patients, but also it improves the surgeon's performance so they can do an outstanding job too.
Interesting.
Dr. Kurt Wehberg, thank you so much for coming in and updating us on robotic surgery at TidalHealth.
Thanks for having me.